So there is a coronary process here, and so posterior dislocation leads to get a kind of break for the coronary, which is in front of the coronary. You got it? You got it? Okay. So this is a very nice actually problem for you, of course. It's a very worst situation for the patient, but it's very nice for you because he or she must come to your office for about 4 months, 6 months. So it's very good for you, but not for him. Okay, that was the reason of trivial trial. So you know how can you behave, how can you care about the upper extremity or the elbow joint or the upper end of the elbow joint or probably lower end of the humerus. You know that. So when you have a kind of complex problem, you can set all of these plan of the treatment all together. Say hi. And get a kind of actually approach by the information you got it. Knowledge, practice, courage. Okay? Come on. And this is the mechanism for trivial trial. The mechanism for trivial trial. So there is a kind of probably bicycle driver, and get a kind of stock and putting forward, throw it away, and got a kind of injury this way. It's a kind of hyperextension, rotation, Mustafa. Hyperextension, rotation. And so it provides 3 items, including the items which I explained for you. Any question? Okay, so let's move a little forward. That is another type of the fracture at the area. We are heading to the body of the elbow. You see the body of elbow. The most famous one is knife stick. Knife stick, why? Because sometimes a robber invading you, person who got a knife stick, that actually the person who want to try to defend himself, and a bead or a kind of bar, put it on the middle of the elbow area, I mean the radius or ulna, so it's going to be a kind of middle part of body of the radius or ulna. So we call it midnight or knife stick fracture. You can see the knife stick here. And what is the density of the bone here? Decrease density of bone. So how can it decrease? Is it senile? Don't think so. Because the bones are not actually too old. But why the reason of this decrease in density of the bone? Why we do have it? Why? The kind of guess. It's osteoporosis. Sometimes it happens physiologically after the age of 50 or something. Okay? But the shape of the bone is not very old. That was the reason I'm looking to identify why we have a deficiency in the bone actual density. Might be, we don't have any idea because we don't see the lab test or the information or evaluation of the patient. But might be because of something they got it from outside. Exactly, such as 1, 2, smoking, 2, alcoholism, and 3, diabetes. Might be reason of this such a kind of osteoporosis. Okay, so we are having more, a little more. Just I'm asking you to remember two names, ladies. Just I'm asking you to remember two names. Can I? Can you do remember just two names? Two names. Don't make them wrong with each other. Just two names. Montagia and the other one is Galatia. Double Z, that means Etzia, Z-T, Etzia. So, Montagia and Galatia. Please do remember these two names. They are two people, two scientists, two physicians. Montagia, both of them are Italian. Montagia was the first person who explained this type of the fracture. So if you have a kind of referral paper to say, hello my friend, my colleague, Dr. X, this is a grade 2 Montagia fracture. The surgeon, the orthopedic professionals, think that you know the meaning of Montagia, so you must learn it. Okay. You must learn it. I told you, in whole of the fractures, it's about 20 specific names, including Cullis fracture, or DRF, or Montagia, or something like that. Legor. Montagia fracture is including the upper end of the, say hi. The upper end of the elbow, and it's including have a look to the nice X-ray, which I did find for you. It's including the upper end of the ulnar area, fracture at this area, dislocation of what? Head of the radius, and also a kind of rupture between the anastomosis, between these actually two bones, and there is an annular ligament around the radius, and you do rupture in the annular ligament. So the Montagia is a fracture of 1/3 superior of the ulna and dislocation of the head of the radius, and somehow tearing in anastomosis or in the membrane between the radius and ulna at the superior side. Okay, you got it. And so, how can we provide a kind of, come on, ladies, how can we provide a kind of fixation? The first initial step for all of the fracture is immobilization. Ravan? That's very important. Okay. The fixation. Have a look at the fixation. Tell me, what is that?
Simple plate.
A simple plate?
No. Yes.
What the hole?
Yes. Simple come. It's a plate.
It's plate and a screw. I got it. But there are some empty space. So it probably is dynamic compression plate. Probably. Because you can see it here. You can see it here. There are some empty plates. So in dynamic compression plate. How many screw on there? 1, 2, 3, 4, 5, 6, and back. What will be happen for this person? What will be happen for you as a therapist? Can you reach the